Administration of intravenous medication via infusion. Clean hands as per trust policy. Check e-meds or codex for medication, the dose, the date and time of administration, route, method of administration, any allergies or sensitivities, and time of last administration. This is to ensure that the patient is given the correct medication in the prescribed dose via the correct route using the right method at the right time. Check all details with a registered healthcare professional competent in IV administration. This is to minimise any risk of error, and 2 registered nursing associates cannot give IV medications together. The second checker must always be a registered nurse. Begin by cleaning hands as per trust policy and apply an apron and non-sterile clean gloves. Prime the IV administration set with the medication to be administered. Then place pre and post flush syringes, Clinell wide, in the clinically clean receiver or tray. Remove apron and gloves and clean hands as per trust policy. Then proceed to the patient, explain and discuss the procedure with the patient and check the patient's ID with the registered healthcare professional. This is to ensure that the patient understands the procedure and gives consent. You can then hang the infusion on a drip stand or attach to an infusion pump if required. If using an infusion pump, set the rate and volume to be infused and have this checked by a registered healthcare professional. Then inspect the insertion site of the cannula. This is to detect any signs of inflammation, infiltration, and if present, the appropriate action must be taken as per the care plan. You would then clean hands as per trust policy and apply an apron and non-sterile clean gloves. Clean the needle-free device with a Clinell wipe for at least 15 seconds and leave to air dry. Then inject 5 ml of the 0.9 sodium chloride for injection via the needle-free device. This is to confirm the patency of the cannula. Check that there is no resistance, no pain or discomfort, and there is no swelling evident and no leaking occurs around the cannula. This ensures that the cannula is patent and correctly positioned. Then connect the administration set to the needle-free device on the cannula. You can then open the control valve on the administration set to the prescribed rate if the infusion is being delivered free flow. Check the insertion site again and ask if the patient is comfortable. This is to ensure that the cannula is patent and the drug is being delivered. If necessary, tape the administration set in a way that places no strain on the cannula, as this could damage the vein. This also reduces the risk of mechanical phlebitis or infiltration. Dispose of all waste at the point of care, adhering to trust policy, and then remove apron and gloves. Once the medication has been administered, close the control valve on the administration set. This is to ensure all of the prescribed medication has been delivered. Then apply apron and non-sterile clean gloves. Then disconnect the administration set and flush the cannula via the needle-free device with 3 to 5 ml of 0.5% sodium chloride for injection. This is to flush away any remaining solution from the cannula. You would then dispose of all waste at the point of care adhering to trust policy to minimise the risk of sharps injury and to prevent cross-contamination. Removing apron and gloves and cleaning hands as per trust policy, you can then record the administration of the medication on the patient's fluid balance chart and document in the care plan. This is to maintain accurate records and prevent duplication of treatment.